Question 1. A patient is 30 minutes post-op from a bowel resection and becomes restless with a respiratory rate of 28 and SpO2 of 88% on 2L nasal cannula. What is the nurse's priority action? A. Notify the surgeon immediately. B. Increase oxygen to 4 liters per minute. C. Perform a rapid respiratory assessment. D. Administer PRN morphine. Answer. C. Perform a rapid respiratory assessment. Rationale. The nurse must first assess before acting. Restlessness and hypoxia can signal early respiratory distress or hypovolemia. Assessment directs safe intervention. Question 2. A patient recovering from thyroidectomy suddenly becomes hoarse and has stridor. What is the nurse's immediate action? A. Elevate the head of the bed. B. Apply oxygen via face mask. C. Prepare for emergency tracheostomy. D. Check calcium level stat. Answer. C. Prepare for emergency tracheostomy. Rationale. Stridor indicates airway obstruction, possibly from laryngeal edema. The airway must be secured immediately. Calcium is important but not the first priority here. Question 3. A post-op patient develops increased pain, pallor, pulselessness, and paresthesia in a limb with a cast. What should the nurse do first? A. Reassess in 30 minutes. B. Elevate the limb. C. Loosen the cast and notify the surgeon. D. Administer for analgesia. Answer. C. Loosen the cast and notify the surgeon. Rationale. These are signs of compartment syndrome, a surgical emergency. Delaying intervention could result in permanent tissue damage. Elevation can worsen ischemia. Question 4. A patient scheduled for surgery refuses to remove their religious necklace despite facility policy. What should the nurse do? A. Remove the necklace without consent. B. Cancel the procedure. C. Document the refusal and notify the surgical team. D. Tape the necklace to the skin under the gown. Answer. C. Document the refusal and notify the surgical team. Rationale. This respects patient autonomy while ensuring team awareness for risk mitigation. Forcing removal violates ethical and legal principles. Question 5. A post-op patient becomes hypotensive with flat neck veins and tachycardia. What complication is most likely? A. Cardiac tamponade. B. Internal hemorrhage. C. Anaphylactic reaction. D. Fluid overload. Answer. B. Internal hemorrhage. Rationale. Flat neck veins and hypotension suggest volume loss from internal bleeding. Cardiac tamponade typically presents with elevated neck veins. Question 6. While transferring a post-op patient, the nurse notices the chest tube has dislodged. What is the first action? A. Clamp the chest tube. B. Notify the provider. C. Apply sterile gauze taped on 3 sides. D. Insert a new tube. Answer. C. Apply sterile gauze taped on 3 sides. Rationale. This prevents tension pneumothorax by allowing air to escape while protecting the site. Clamping can worsen the condition. Question 7. A post-op patient on warfarin develops bleeding from the surgical site. Which lab is most urgent? A. Hemoglobin. B. INR. C. Platelet count. D. PTT. Answer. B. INR. Rationale. INR specifically reflects warfarin effect. An elevated INR increases bleeding risk. This must be assessed to reverse anticoagulation. Question 8. A patient post-laparoscopy reports severe shoulder pain and abdominal distension. What should the nurse prioritize? A. Reassure the patient this is expected. B. Assess bowel sounds. C. Evaluate for referred diaphragmatic pain. D. Position patient flat and increase fluids. Answer. C. Evaluate for referred diaphragmatic pain. Rationale. CO2 insufflation during laparoscopy can irritate the phrenic nerve, leading to shoulder pain. Recognizing this prevents unnecessary panic or tests. Question 9. After abdominal surgery, a patient has no urine output for 6 hours. What is the most appropriate action? A. Encourage fluid intake. B. Assess for bladder distension and check catheter patency. C. Administer diuretic per PRN order. D. Document and recheck in 4 hours. Answer. B. Assess for bladder distension and check catheter patency. Rationale. The nurse must assess for retention or obstruction first before intervening pharmacologically. Question 10. A patient reports severe nausea post-anesthesia and begins vomiting. What risk is the nurse most concerned about? A. Pain escalation. B. Hypoglycemia. C. Wound dehiscence. D. Constipation. Answer. C. Wound dehiscence. Rationale. Vomiting increases intra-abdominal pressure and can cause wound dehiscence, especially in abdominal surgery patients. Question 11. A confused elderly patient pulls out their 4 and begins wandering post-op. What is the most appropriate nursing intervention? A. Apply restraints. B. Contact the physician. C. Move the patient to a room closer to the nurse's station. D. Administer PRN haloperidol. Answer. C. Move the patient to a room closer to the nurse's station. Rationale. This promotes safety without violating patient rights. Restraints and medications should be last resorts. Question 12. A patient is 2 days post-op with an elevated WBC, localized warmth, and purulent wound drainage. What is the nurse's best action? A. Send wound culture and notify provider. B. Increase oral fluids. C. Document the findings. D. Begin antibiotics from another patient's profile. Answer. A. Send wound culture and notify provider. Rationale. Culturing the wound ensures correct antibiotic therapy. Delay in reporting may lead to systemic infection. Question 13. The nurse prepares to give a beta blocker pre-op. The patient's BP is 88/56 millimeter of mercury. What is the most appropriate action? A. Administer as prescribed. B. Hold the dose and contact the provider. C. Administer half the dose. D. Recheck BP in 2 hours. Answer. B. Hold the dose and contact the provider. Rationale. Beta blockers can worsen hypotension. The nurse must evaluate parameters before administering medications, especially preoperatively. Question 14. A patient has a latex allergy and is scheduled for surgery. What should the nurse do first? A. Notify the OR and ensure latex-free supplies. B. Apply an allergy bracelet. C. Administer diphenhydramine. D. Cancel the procedure. Answer. A. Notify the OR and ensure latex-free supplies. Rationale. Latex exposure in surgery can cause anaphylaxis. All team members must be informed immediately to prevent exposure. Question 15. A post-op cardiac surgery patient's telemetry shows new-onset atrial fibrillation with HR of 160. What should the nurse do first? A. Notify cardiology stat. B. Administer PRN beta blocker. C. Apply oxygen and assess perfusion. D. Increase 4 fluids. Answer. C. Apply oxygen and assess perfusion. Rationale. Rapid atrial fibrillation post-op can compromise perfusion. Oxygen and assessment stabilize the patient before drug intervention. Question 16. A nurse suspects malignant hyperthermia in a patient under general anesthesia. What is the priority nursing action? A. Notify the surgical team. B. Administer dantrolene sodium. C. Apply cooling blankets. D. Document the event. Answer. B. Administer dantrolene sodium. Rationale. Dantrolene is the only antidote for malignant hyperthermia. It must be given immediately to prevent death. Cooling is supportive. Question 17. A patient develops new confusion 24 hours after orthopedic surgery. What is the most likely cause? A. Pain medication overdose. B. Postoperative delirium. C. Electrolyte imbalance. D. Stroke. Answer: B. Postoperative delirium. Rationale: elderly patients are at high risk for delirium after surgery. Early identification prevents falls and improves outcomes. Other causes are possible, but less common in early post-op. Question 18. Which patient scenario represents a breach of informed consent in surgical care? A. Patient signs consent while on morphine. B. Interpreter is used during consent. C. Nurse witnesses consent form signature. D. Patient asks questions before signing. Answer: A. Patient signs consent while on morphine. Rationale: consent must be informed and voluntary. Morphine can impair cognition, invalidating consent. Question 19. During surgery, the nurse identifies the wrong limb is being prepped. What is the nurse's immediate action? A. Notify the circulating nurse and stop the procedure. B. Wait until the surgeon is finished prepping. C. Leave the OR to inform risk management. D. File an incident report. Answer: A. Notify the circulating nurse and stop the procedure. Rationale: any team member can stop the procedure for safety. Immediate action prevents a sentinel event. Question 20. A patient 6 hours post-op develops oliguria, crackles in lungs, and jugular vein distension. What complication does this suggest? A. Dehydration. B. Heart failure from fluid overload. C. Sepsis. D. Hypokalemia. Answer: B. Heart failure from fluid overload. Rationale: crackles, JVD, and reduced urine output suggest overload and cardiac compromise. Early recognition is key to prevent pulmonary edema. Question 21. A patient post-colectomy becomes pale, confused, and reports flank pain with a distended abdomen. What is the nurse's priority action? A. Increase 4 fluids. B. Notify the provider immediately. C. Check hemoglobin and hematocrit. D. Reassess vital signs in 10 minutes. Answer: B. Notify the provider immediately. Rationale: these are signs of internal hemorrhage and potential hypovolemic shock. The provider must be notified immediately while initiating emergency protocols. Question 22. A post-op CAB patient has jugular vein distension, muffled heart sounds, and hypotension. What should the nurse prepare for? A. Electrocardioversion. B. CT scan of the chest. C. Emergency pericardiocentesis. D. Administration of beta blockers. Answer: C. Emergency pericardiocentesis. Rationale: this is Bextriad, suggesting cardiac tamponade, a life-threatening emergency requiring immediate decompression. Question 23. In PACU, a post-op patient develops oxygen desaturation, restlessness, and frothy pink sputum. What is the nurse's immediate intervention? A. Position the patient upright and apply high-flow oxygen. B. Administer PRN, opioid for anxiety. C. Suction the airway and decrease 4 fluids. D. Call for crash cart and initiate CPR. Answer: A. Position the patient upright and apply high-flow oxygen. Rationale: these are signs of acute pulmonary edema. Immediate positioning and oxygenation prevent respiratory collapse while notifying the provider. Question 24. During surgery, the anesthesiologist notes a rapid rise in temperature, muscle rigidity, and tachycardia. What is the nurse's priority? A. Administer oxygen at 2 liters per minute. B. Increase 4 fluid rate. C. Administer 4 dantrolene sodium. D. Stop all antibiotics. Answer: C. Administer 4 dantrolene sodium. Rationale: Malignant hyperthermia requires immediate administration of dantrolene to reverse the hypermetabolic process and prevent death. Question 25. A post-op liver transplant patient has sudden mental status changes, bleeding at 4 sites, and oozing from the surgical incision. What should the nurse anticipate? A. Acute renal failure. B. Disseminated intravascular coagulation (DIC). C. Septic shock. D. Hepatic encephalopathy. Answer: B. Disseminated intravascular coagulation (DIC). Rationale: the combination of neurochanges and uncontrolled bleeding indicates DIC, a life-threatening coagulopathy requiring urgent labs and reversal agents. Question 26. A patient develops sudden severe abdominal pain and shoulder tip pain 2 hours post-laparoscopic cholecystectomy. What is the most urgent concern? A. Referred pain from CO2 gas. B. Surgical site dehiscence. C. Bile leak or visceral perforation. D. Muscle strain. Answer: C. Bile leak or visceral perforation. Rationale: sudden pain with peritoneal irritation after abdominal surgery suggests perforation or bile leak requiring immediate intervention. Question 27. A patient returns from or after prostatectomy and complains of bladder spasms with no urine output in catheter. What should the nurse do first? A. Increase 4 fluids. B. Administer antispasmodic medication. C. Check for catheter obstruction or kinking. D. Reinsert catheter. Answer: C. Check for catheter obstruction or kinking. Rationale: pain with no output may be caused by blockage, risking bladder rupture. Never medicate or replace before assessing patency. Question 28. During surgical handoff, the nurse notices a patient received an incorrect dose of heparin intraoperatively. What is the most ethical nursing action? A. Document and inform the patient post-op. B. Report the error to the charge nurse and risk management immediately. C. Wait to see if the patient develops complications. D. Inform the surgeon and allow them to report. Answer: B. Report the error to the charge nurse and risk management immediately. Rationale: transparency and accountability are essential. Timely reporting ensures patient safety and initiates appropriate monitoring and treatment. Question 29. A patient post-spinal fusion is on a morphine PCA. The family repeatedly presses the PCA button while the patient is asleep. What is the nurse's immediate action? A. Disable the PCA. B. Instruct the family about patient-controlled dosing only. C. Administer naloxone. D. Increase lockout interval. Answer: B. Instruct the family about patient-controlled dosing only. Rationale: only the patient should activate the PCA. Family interference can cause overdose. Education preserves safety and autonomy. Question 30. A patient is admitted post-op with HR 120, BP 82/50, CVP 2 mm of mercury, and cold extremities. Which intervention takes priority? A. Increase oral fluids. B. Initiate norepinephrine drip. C. Administer 4 bolus fluids. D. Insert indwelling catheter. Answer: C. Administer 4 bolus fluids. Rationale: these are signs of hypovolemic shock. Rapid volume replacement is essential to restore perfusion before vasopressors. Question 31. A nurse observes that the sterile field was contaminated by a surgical tech, but they deny it. What is the nurse's responsibility? A. Quietly continue and document after surgery. B. Remove the surgical tech from the field. C. Immediately stop and initiate correction of the field. D. Notify the surgeon at the end of the procedure. Answer: C. Immediately stop and initiate correction of the field. Rationale: sterile field breaches require immediate correction to prevent patient harm and infection. Question 32. A patient is 48 hours post-abdominal surgery and develops severe hypokalemia. What is the most concerning finding? A. Decreased bowel sounds. B. Serum potassium of 3.1 milliequivalent/L. C. Flat T waves on ECG. D. Irregular pulse and muscle weakness. Answer: D. Irregular pulse and muscle weakness. Rationale: hypokalemia affects cardiac and neuromuscular function. Cardiac irregularities can be fatal and require urgent correction. Question 33. During surgery, a nurse notes that the sponge count is off. The surgeon insists it's fine. What should the nurse do? A. Document surgeon's response. B. Perform X-ray sponge count before closing. C. Count again after closure. D. File an incident report after surgery. Answer: B. Perform X-ray sponge count before closing. Rationale: a retained sponge is a never event. An X-ray must be done before wound closure to confirm no foreign object remains. Question 34. A patient becomes hypotensive and tachycardic post-op despite fluid resuscitation. Which complication should the nurse suspect? A. Sepsis. B. Third spacing from capillary leak. C. Normal post-op fluid shift. D. Hypoalbuminemia. Answer: B. Third spacing from capillary leak. Rationale: severe inflammatory response can cause third spacing, leading to fluid loss into interstitial spaces. This requires aggressive fluid and albumin support. Question 35. In PACU, the nurse finds a patient with clenched jaw, rigid muscles, and temperature of 103 degrees Fahrenheit. What is the nurse's first action? A. Increase for fluid rate. B. Remove warm blankets. C. Call anesthesia and prepare dantrolene. D. Apply oxygen mask. Answer: C. Call anesthesia and prepare dantrolene. Rationale: these are early signs of malignant hyperthermia. Rapid dantrolene administration is life-saving. Question 36. After vascular surgery, the patient's foot is pale, cold, and pulseless. What should the nurse do first? A. Elevate the limb. B. Apply warm compresses. C. Notify the surgeon immediately. D. Document and recheck in 1 hour. Answer: C. Notify the surgeon immediately. Rationale: these signs indicate arterial occlusion or compartment syndrome. Delay could result in limb loss. Question 37. A post-op patient on opioid analgesia becomes increasingly drowsy and unresponsive to verbal stimuli. What is the most critical next step? A. Decrease opioid dose. B. Elevate head of bed. C. Administer naloxone and prepare for airway management. D. Apply oxygen and monitor. Answer: C. Administer naloxone and prepare for airway management. Rationale: the patient is experiencing opioid overdose. Naloxone is urgently required to reverse CNS depression and prevent respiratory failure. Question 38. A patient undergoing emergent surgery speaks a different language, and no interpreter is available. What is the most ethical action? A. Use a bilingual staff member. B. Proceed with surgery without consent. C. Use a professional phone interpreter. D. Have the family explain the procedure. Answer: C. Use a professional phone interpreter. Rationale: consent must be informed and legally valid. Using professional interpreters ensures accurate, ethical communication. Question 39. A nurse notices a colleague documenting vital signs not actually taken during surgery. What is the best immediate response? A. Report to supervisor after the case. B. Ask the colleague privately to stop. C. Document the concern in the chart. D. Report the incident to the charge nurse immediately. Answer: D. Report the incident to the charge nurse immediately. Rationale: Falsifying documentation endangers patients and violates legal/ethical standards. Immediate reporting is required. Question 40. Post-op from a bowel resection. A patient has increasing abdominal girth, hypotension, and rising peak airway pressures on the ventilator. What should the nurse suspect? A. Bowel obstruction. B. Abdominal compartment syndrome. C. Pulmonary embolism. D. Gastric dilation. Answer: B. Abdominal compartment syndrome. Rationale: this is a surgical emergency due to pressure buildup. It compromises circulation and ventilation and needs immediate decompression. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.